After we were discharged, we went through the pediatrician a couple of times in the first few weeks and then moved to monthly visits, and then started following the usual well visit schedule for babies in the first year. The most important thing that had to be checked was Maya's growth. Our pediatrician also made sure that Maya received all her vaccinations based on her date of birth. Keeping track of all appointments was the biggest priority. We made sure to follow up with all of the medical providers, and it was helpful that we had all our appointments in our app on the phone.
And NICU helped us set up our first initial pediatric visit. Every visit was just asking the questions and making sure that she's like doing well, like progressing well, like for her stage.
Like many other NICU babies, Maya had several important visits after we went home from the NICU. She didn't pass her hearing test in the NICU. So even though we felt that her hearing seemed just fine, we had to have 2 different follow-up visits to check her hearing. We learned that follow-up hearing and vision screening tests are common for premature babies. We also had follow-up with a high-risk NICU follow-up program and early intervention.
The specialists that Ellie had to see after discharge are aerodigestive, pulmonary, and endocrinology. Lucky for us, her appointments are tracked through an app. We have regular visits with them where they just see how she's doing and if any special follow-up care is needed.
So there were a series of specialists that Miller did have to see after we did leave the NICU: pulmonology, ophthalmology, neurology, just to name a few. And as time went, the number of appointments we had, the number of visits kind of slowly started to get fewer and fewer as she got healthier and healthier. So it was definitely a nice change as things quieted down as time went.
Early intervention is a service available for all babies ages 0 to 3 years old who qualify for services. Maya qualified because of her prematurity. Maya met with an occupational therapist who works with her to help her meet her developmental milestones.
Early intervention was coordinated prior to leaving the NICU, and they reached out, I think, within the first week or 2 of bringing Ellie home. They set up an appointment where they came to our house and they evaluated Ellie's development. We talked about goals and came up with a plan, what we wanted to see in the coming months of her development. At first they came once a week, and then they would just come do physical therapy with her basically and just really evaluate how she's doing on a weekly basis, and we still see them every other week now.
Early intervention is they keep up with Giovanni, so they make sure at first when he first got home, they make sure that he was able to move his little body to, the first started with stretching his arm, make sure he's open and close his little fingers, his little toes, move his neck a little bit, and then do massage for him. That's how it started. But now it's all about, because he's growing and they are growing with him. So now he's getting speech therapy. So now they come home, they play with him, they make sure he's able to talk or he's able to follow direction, make sure that he's growing the way he's supposed to be growing.
Once we met the early intervention specialist when she came into the house, we quickly realized how important that was and how much we were gaining from that, just from having someone else come in and be a set of eyes to help with things, to just sort of say, what can we be doing developmentally with our son to make sure that he's on track? Because I think, without that, our pediatrician, we were only seeing, maybe every couple of weeks, and then it spaced out. But we were seeing the EI team once a week for quite a long time.